information going inside the opioid epidemic. This is a devastating problem that is touching every corner of our state.
And for the past few months, the I-Team has been on the front lines of the battle to show you what it's really like and what's being done to fight it. Kath has our story tonight from Plymouth, one of the hardest hit areas of Massachusetts.
What's going on there?
I think he overdosed.
Is he breathing?
Very, very lightly.
We're going to overdoses every day.
This is the opioid crisis in real life. A man in his 20s, barely breathing, revived with Narcan and rushed to the ER at Beth Israel Deaconess Plymouth after shooting heroin. These days, it's something that Dr. Mark DiMatteo sees all the time.
You get a sense of how close this was if the ambulance hadn't gotten there?
I think if the ambulance hadn't gotten there, he probably would have died.
The Plymouth area has been hit hard. In 2014, 42 people died of overdoses in the towns surrounding this hospital.
I've been involved in emergency medicine for almost 34 years now, and this has never been as complicated as it is now, or taxing on the system, or as dangerous to our population. It truly is terrifying.
Dr. DiMatteo allowed the I-Team to follow him on several night shifts.
It's not unusual for us to have to revive someone from an overdose early in the evening and have them return later on in the evening.
We believe it's an epidemic.
That's why Plymouth Police Chief Mike Bodieri is changing how his department is approaching opioid abuse.
We can't arrest our way out of this problem.
We had a couple overdoses last night.
There's the new street crimes unit, armed with binoculars and Narcan.
Push that in.
Officers David Ross and Seth Johnson patrol streets and alleyways trying to stop a problem before it starts.
High school kids, older people, girls, guys. It's one of those drugs that doesn't really discriminate.
I'm on methadone.
On this night, they assist a confused man on methadone and respond to a call for a rehab patient who ran into the woods.
Downtown area in the waterfront.
Chief Bodieri is taking it up a notch, coordinating with healthcare workers to make house calls after an overdose.
We need to be at their door the next morning. And in the last 6 weeks, I think we've placed people in bed somewhere around 6 to 8 times. So we're happy with that. We feel like that's successful.
Back at the hospital, they're also making changes. Social workers and mental health professionals are now embedded in the ER to be part of the treatment plan early. This concept is becoming a model for community hospitals statewide, and they were recently awarded a $3.7 million grant to fund their work. Liz Azevedo shows that intervention and treatment can work. The former Marine became addicted to heroin after a drinking problem got out of hand. She's encouraged by the changes she sees in her hometown.
We can't just let a whole generation die. You know, or even these generations coming up, like it's starting younger and younger, and it's becoming more and more powerful, the drugs.
Do you really feel like you can change this problem?
Well, you know, I think we have to take our successes in small bites, you know. Our success is the phone calls that I get from a parent who says the best thing you could have done is arrested my son or my daughter because I got them back. If I can have 2 or 3 of those this month, we've done really well.
But Chief Bodieri knows he has his work cut out for him. The number of overdose deaths in Plymouth jumped to 23 last year, up from 15 the year before. And that's after his officers started carrying Narcan. For the I-Team, Kath, WBZ News.